In this video, we are going to talk about the rising cases of heart attack among young population. So as with any heart disease, there is genetic risk factor. So people who are around 40 years of age and who have family members that have suffered from heart disease, they must be screened for any kind of heart disease. Screening is very, very important in such cases, and it can help prevent fatal heart attack in future. There are genetic conditions like hypertrophic obstructive cardiomyopathy, Brugada syndrome, in which there is increased risk of ventricular fibrillation and sudden cardiac death. So screening is very, very important, especially if you are around 40 years of age and you have a familial risk. In Indian men, it is seen that lipoprotein A is on the higher side, and higher lipoprotein A means that there is increased risk of clot formation, and subsequently there is increased risk of heart attack. So Indian men must get their lipoprotein A tested, and if it is on the higher side, they must consult their cardiologist and follow a particular lifestyle which they will be likely prescribed by the cardiologist. They must eat a lot of fermented foods, because fermented foods have antifibrinolytic activity, and that can help in smooth blood flow and prevent clot formation. They can also consider taking a nattokinase supplement, which will decrease the risk of clot formation. And they can also consider taking a B3 supplement to lower the level of lipoprotein A after consulting with their cardiologist. And they're also advised to consume a lot of vitamin C rich foods as well as good sources of protein for those people whose lipoprotein A is on the higher side, and they must be in touch with their cardiologist. So the number one tip is screening that can help prevent fatal heart attack in future. Next important thing is you have to give due importance to diet, sleep, and exercise. All the three components are equally important. I see a lot of people who either they do not exercise at all, or if they exercise, they overdo it and they compromise on their sleep, especially the quality of sleep. You want to get a good quality sleep because sleep helps you to recover from the day-to-day stressful activities. And it's very important to regulate your stress hormone, that is cortisol. And if your cortisol is always high, what happens that it can lead to inflammation, endothelial dysfunction, and it can elevate the chances of atherosclerosis. Exercise is important, but you have to take all this diet, sleep, and exercise into account and give due importance to each one of them, because exercise is a form of stress for your body. You are basically depleting your body of certain nutrients like magnesium, potassium. And what happens that if you do not replenish those electrolytes, and if you do not get enough protein in your diet, what happens that there is chance that your body may undergo a very stressful condition. So exercise, which is a positive stress for your body, can translate into a negative stress if you do not give due importance to diet and sleep. So both are equally important. 3 to 4 times exercise per week is more than enough for a normal individual. You must also try to do activities which will relax your mind. It can be anything. It can be listening to your favorite music. It can be surrounding yourself with the people you like. It can be pursuing your hobbies. So any type of activities that calms your nervous system is going to prolong the lifespan of your heart. Third important thing is air pollution. Air pollution is causing a lot of problems, especially for your heart. There is one study which showed that exposure to air pollutants can cause heart attack within 1 hour of exposure. You get heart attack. Although there are multiple studies that have shown the harmful effect of air pollutant on lungs, there are few studies that have demonstrated the harmful effects of air pollutants which are outside your lung, extrapulmonary effect. And we need a lot of other good quality studies, but this one study is an eye-opener, especially because people do not give due importance to the quality of air they breathe. Air pollution can, especially the ultrafine particles, they can enter into the alveoli of lungs and then can enter the bloodstream because they are very tiny particles and they carry a large surface area, and so they carry a lot of toxic materials with them. So once they reach the bloodstream after crossing the alveolar capillary membrane, they can cause endothelial dysfunction and can increase the risk of non-obstructive atherosclerotic lesions. So it's very important that besides wearing mask and all those things, from the nutritional aspect, it is important that you give due focus to anti-inflammatory diet and antioxidant-rich diet. Because basically what these ultrafine particles do inside your blood vessel is they cause increase in inflammation and they cause increase in the oxidative stress. And few clinical studies have pointed that if you take 2 grams of fish oil or omega-3 supplement, it is effective in counteracting the negative effect of ultrafine particles on your blood vessels, which is endothelial dysfunction. So you need to consume omega-3 rich diet because it will counteract the pro-inflammatory response which you get from ultrafine particles of the air pollution. It's also very important that you avoid strenuous exercise when you are in a polluted area, because that can cause increased chance of heart attack, because already the ultrafine particles will constrict the blood vessels, and moreover, if you do strenuous exercise in such a polluted environment, you are doubling the risk of decreased blood flow and heart attack. So it's very important that you eat an anti-inflammatory and antioxidant rich diet. Third important thing is nutritional deficiencies. So nutritional deficiencies have a very important role because there are a lot of nutrients, especially magnesium, vitamin D, and vitamin K2, which have been proven in multiple clinical studies to prevent atherosclerosis. So you need to choose your foods wisely. Choose your foods on the basis of their nutrient profile rather than going for your taste buds. So if you take too much of junk food, so what happens that you're basically eating a lot of calories but not getting a lot of nutrients. And being in a state of chronic calorie surplus will increase the risk of hyperinsulinemia, insulin resistance, high blood pressure, and that can cause increased risk of heart attack. Moreover, if you do not get enough magnesium, what happens that there will be increased influx of calcium ion into your cell, and that can again cause increased chance of insulin resistance and high blood pressure, which are risk factor for heart attack. And we know that vitamin D is very important to prevent arterial stiffness. It helps in counteracting your blood sugar level. It helps to improve insulin sensitivity. And most of us are deficient in vitamin D. And if you have a genetic predisposition towards heart attack, and if you are deficient in vitamin D, then you are just doubling your risk of getting heart attack in near future. Also, you need to consume enough K2 in your diet or consider taking a supplement, because K2 prevents vascular calcification. And if you do not get enough K2, what happens that your arteries get calcified and there is impairment to the flow of blood that can lead to heart attack. So it's very important that you follow a healthy lifestyle, give due importance to your sleep, quality of sleep, and go for regular screening, especially if you are over 40 years of age and have a familial history.